Did you know that more than 1.5 million seniors live in nursing homes in the US? But is that really the best option for everyone? What if staying at home could actually be better for your health and happiness? As we age, we all face the challenge of maintaining independence, and it can sometimes feel like moving into a nursing home is the only option. But what if that's not true? In today's video, we'll explore why moving to a nursing home may not be the best decision for everyone, and why staying at home, even without full self-care, could be a healthier and happier choice. After watching, you'll understand the benefits of staying at home, as well as what alternatives might be available to you, so you can make a more informed decision. Make sure to watch the complete video. Don't skip any part. If you miss any of the key points, you could lose out on important information that could change your life. Home care offers personalized attention when considering long-term care options. One of the main benefits of staying at home instead of moving to a nursing home is the personalized attention you can receive through home care. Unlike nursing homes, where care is often divided among many residents, home care offers a unique opportunity for focused, one-on-one support. A caregiver can tailor their assistance to your specific needs, from helping with daily tasks like bathing, dressing, and meal preparation to ensuring medication is taken on time. Research consistently shows that seniors who receive personalized care at home often experience higher levels of satisfaction and well-being compared to those in institutional settings. According to the Journal of Aging and Social Policy, home care patients report feeling more in control of their lives because they can dictate the pace and nature of their care. Take the example of Mary, a 78-year-old woman suffering from arthritis. She was initially considering moving into a nursing home but decided to opt for home care instead. With a caregiver who assisted her with light housekeeping and meal preparation, Mary was able to continue with her daily routines, like tending to her garden and attending local events, which are things she would have had to give up if she moved to a facility. Over time, Mary found that the ability to stay in her own home not only improved her physical health but also her mental and emotional well-being. This individualized care can also help seniors maintain a sense of independence and autonomy, which is essential for maintaining dignity. While institutional care may be necessary for some, home care allows for flexibility and personal choice. For seniors like Mary, who are still relatively independent but need some assistance, home care is often the ideal solution, providing care without stripping away their ability to make decisions about how they live. Thus, it becomes clear that home care offers a much more personalized and empowering way to age, compared to the one-size-fits-all approach of nursing homes. Staying home preserves mental health. One of the major reasons staying at home rather than moving to a nursing home can be beneficial is the psychological impact of familiar surroundings. When you remain in your own home, you're surrounded by memories, personal belongings, and a sense of comfort. Research has shown that familiar environments are crucial for maintaining mental health, especially in older adults. The Journal of Environmental Psychology suggests that staying in a familiar setting helps reduce stress and anxiety, as it provides a sense of safety and control. Take John, for example. At 82, he struggled with the early stages of dementia. When his family first suggested moving him to a nursing home, John became visibly upset. The idea of leaving his home, where he had lived for over 50 years, was overwhelming. Instead, his family opted for home care, providing him with a caregiver who helped with his daily needs. Although John's memory was beginning to fade, being in his own house allowed him to hold on to his identity and routines longer than if he had been in an unfamiliar environment. His caregiver tailored activities to his preferences, including his favorite walks in the neighborhood, which helped reduce his anxiety and kept him engaged. A study published in The Lancet highlights the importance of familiar surroundings for people with dementia, showing that staying at home can slow cognitive decline. The comfort and emotional security derived from staying in a known environment can significantly reduce confusion and agitation, which are common symptoms in elderly patients with cognitive issues. Additionally, maintaining connections with the local community plays a huge role. For example, John could still visit his neighbors, attend local events, and enjoy the local park, which kept him socially engaged and mentally stimulated. This sense of community is often lost when someone transitions to a nursing home, where they might be isolated from their long-term social networks. In summary, staying in familiar surroundings can have profound psychological benefits. It helps seniors maintain a sense of identity, reduces stress, and slows cognitive decline, making it a compelling reason to avoid nursing homes if possible. Home care helps preserve independence. Another compelling reason to stay at home instead of moving to a nursing home is the enhanced physical well-being that often results from more autonomy and less exposure to illness. In nursing homes, seniors are often exposed to germs and infections due to the close proximity to other residents. In fact, studies have shown that nursing homes can be hotbeds for infections like the flu, respiratory infections, and even urinary tract infections. This is particularly concerning for elderly individuals who may already have weakened immune systems. At home, seniors have more control over their environment. For example, they can limit the number of visitors and ensure their home is kept clean to their standards. This reduced exposure to infections can significantly decrease the risk of developing illnesses that can quickly escalate in an institutional setting. A study published in the Journal of Gerontology found that older adults who received care at home were less likely to experience infections or hospitalizations than those in institutionalized settings, primarily due to the cleaner, more controlled environment of the home. Take the example of Barbara, an 80-year-old woman who had diabetes and was at a high risk for infections. After being in and out of the hospital a few times due to respiratory infections picked up from her nursing home, Barbara decided to hire a caregiver and stay at home. Her caregiver ensured that her living space was sanitized, and Barbara could control who entered her home. Over the course of several months, she noticed fewer health issues, fewer trips to the doctor, and a general improvement in her physical condition. Additionally, the ability to maintain a routine and engage in light exercise at home, whether it's walking around the house or doing stretching exercises, can greatly benefit physical health. Studies have shown that seniors who stay active, even in small ways, have better cardiovascular health and muscle strength than those who are less active. Being at home allows seniors to continue physical activities they enjoy, such as gardening, cooking, or walking in the park, which is more difficult in a nursing home environment where routines and spaces are more restrictive. In conclusion, staying at home helps reduce the risk of infections and allows for better control over one's environment, leading to improved physical health. This can be a major factor in improving both longevity and quality of life. In-home care can be more affordable. Staying at home can also have significant benefits for a senior's overall independence and dignity. Many elderly people value their ability to do things for themselves, and a nursing home can sometimes make this difficult. When living at home, seniors can maintain their daily routines, make decisions about their meals, when to take a bath, and how to spend their day. This autonomy not only preserves their independence but also boosts their mental and emotional health. Research consistently shows that independence in daily life is directly linked to better mental well-being in seniors. A study published in the Journal of Aging and Social Policy revealed that older adults who maintain control over their daily activities are less likely to experience depression and anxiety. The ability to make choices, whether it's deciding on what to wear, what to eat, or what activity to engage in, provides a sense of empowerment and helps preserve self-esteem. Take the story of Robert, a 75-year-old man with mild mobility issues. His family initially considered moving him into a nursing home due to his increasing need for assistance with daily tasks. However, Robert insisted on staying in his own home. His family set up a few modifications, like installing grab bars in the bathroom and hiring a caregiver to assist with heavier tasks. Robert was able to continue cooking his own meals, enjoying his favorite hobby of woodworking, and managing his own schedule. Over time, Robert became more confident in his abilities, and his family noticed an improvement in his mood. He was much happier and more engaged in life than he would have been in a facility where he would have been forced to rely on others for even the smallest tasks. Studies also suggest that maintaining independence and control over daily life activities contributes to better cognitive function. Research from the National Institute on Aging indicates that seniors who engage in decision-making processes and continue with self-care tasks have slower rates of cognitive decline than those who live in environments that limit their autonomy. In conclusion, the ability to remain independent in a familiar environment significantly contributes to maintaining both mental and physical well-being. It helps preserve dignity, enhances self-esteem, and can even improve cognitive function, making staying at home a highly beneficial option for many seniors. The benefits of aging in place. One of the most compelling reasons for seniors to avoid rushing to a nursing home is the emotional support and social connections that are more easily maintained at home. Being surrounded by familiar faces, friends, and family plays a critical role in mental health, especially as we age. In nursing homes, while there are staff members and other residents, the relationships often lack the depth and personal connection that can be found with close family and longtime friends. Scientific studies have shown that emotional support and regular social interaction significantly reduce the risk of mental health issues in the elderly. For instance, research from the journals of gerontology highlights that seniors who maintain strong social connections are less likely to experience depression and loneliness, which are common in institutional settings. This is largely due to the support system that a home environment provides, where seniors are surrounded by loved ones who truly understand their history, needs, and preferences. Consider the case of Eleanor, a 78-year-old woman who had lived alone since her husband passed away. Her children were worried about her health and suggested moving her into a nursing home. Eleanor, however, resisted, preferring to stay in her own house. She had a strong social network of friends who visited regularly, and her daughter, who lived nearby, made sure to spend time with her. Eleanor found comfort in hosting small gatherings with friends and neighbors, maintaining those important connections that gave her a sense of purpose and joy. Over time, her family noticed that she seemed happier and more energetic, and her health seemed to improve as well. She felt less isolated, and the social interactions kept her mentally sharp and emotionally fulfilled. In contrast, seniors in nursing homes often face challenges when it comes to maintaining meaningful relationships. Many older adults in institutionalized settings report feelings of loneliness, partly because of the high staff turnover and the lack of one-on-one attention. The inability to see family frequently or connect with longtime friends can lead to a feeling of abandonment, which has been linked to higher rates of depression and cognitive decline. In conclusion, the emotional and social benefits of staying in a familiar home environment cannot be overstated. Regular interaction with close family and friends helps reduce feelings of isolation, depression, and anxiety, while also contributing to better overall well-being. For many seniors, being at home with a supportive social circle can be a key factor in maintaining mental and emotional health as they age. Caregivers can provide tailored health management. Another significant reason to stay at home instead of moving to a nursing home is the ability to maintain control over your environment. As we age, we often face physical limitations, but in our own homes, we can modify the space to suit our needs. Whether it's adding grab bars in the bathroom, installing ramps instead of stairs, or simply arranging furniture to avoid tripping hazards, being at home gives you the flexibility to create a safer living space tailored to your specific needs. Scientific research consistently supports the idea that a comfortable, familiar living space is better for seniors' well-being. A study from the National Institute on Aging found that the ability to make your own environment safe and comfortable can significantly reduce the risk of falls and injuries. When seniors can customize their home to accommodate mobility issues or other health challenges, it helps prevent accidents that are often more common in institutional settings. The CDC estimates that 1 in 4 seniors falls each year, and falling once doubles the risk of falling again. However, by making strategic adjustments at home, the risk of such incidents can be dramatically reduced. Take the example of George, an 80-year-old man who had suffered a minor stroke. After his hospital stay, his doctors suggested moving him to a nursing home for further care, but George refused. Instead, he and his daughter worked together to make modifications to his home. They added wider doorways for his walker, installed non-slip flooring in the bathroom, and ensured there was adequate lighting throughout the house. George was able to live comfortably at home with a caregiver coming in for a few hours each day to assist with more intensive needs. Not only did this arrangement allow him to maintain a sense of independence, but it also kept him safer. George felt empowered in his own home, knowing he had control over his environment, and this helped him recover faster and feel more confident. In nursing homes, however, seniors often have little control over their living spaces. While the facilities may be equipped for basic needs, they are not as customizable. The inability to modify one's environment to ensure safety or comfort can be a source of stress and discomfort for many residents. Ultimately, maintaining control over your environment contributes to a higher quality of life. Seniors who can adapt their homes to meet their physical needs and personal preferences often experience fewer accidents, better mobility, and a greater sense of security and independence. In conclusion, while a nursing home might seem like the easiest option when you need care, it's important to consider all the benefits of staying at home. Personalized care, mental health preservation, independence, and affordability are just a few reasons why aging in place is often the better choice for seniors. If you or a loved one is considering a move to a nursing home, remember there are other options available that can offer a better quality of life. Take the time to explore home care, family support, and community services that can help you maintain your independence and well-being. Think carefully before making a big decision like moving to a nursing home. Share your thoughts, or share this video with someone who might benefit from this information. Don't forget to subscribe for more tips on living your best life as you age. Remember, staying in your own home could be the key to a longer, healthier life.